Karen's been my patient for a very, very long time, and she was morbidly obese when she first came to see me and had high blood pressure, hypertension, and high cholesterol as well.
Every time I would go in to see my doctor, she would counsel me that I needed to do something. Emotionally, I didn't feel very happy with myself. I was depressed.
Every time she would come in, she wouldn't feel great. She would sometimes feel tired, or her knees would hurt her, and she just in general wasn't feeling good. And really what she needed to change was what she put in her mouth, and she needed to move her body every day. And no matter how many medications I would give her, I could control her blood pressure and control her cholesterol, but ultimately she was the one that had to make the change.
I started to think about the rest of my life. Dr. Oppenheim told me, I needed to increase my physical activity, and once I started eating better and I lost some weight, it became much easier. At first, it's a little hard, but as you change your habits, it just becomes second nature. And so instead of coming home from work and just grabbing whatever fast food I have, I plan ahead of time. I make sure that I have food available that is good for you, nutritious. I eat way more fruit than I used to. Instead of grabbing a packaged snack, it's almost as easy to grab a piece of fruit. It's a lifestyle change more than just a diet. This is just how I eat now, and it's not just a diet that I'm going to be on for a while.
I actually think in recent years it is probably one of the most underappreciated forms of medicine that we have. Because when you look at the improvement of the health of patients who switch from a very high-fat, processed diet to one that is more, whatever you want to call it, plant-based, clean, non-processed, the benefits to these patients are almost instantaneously. Their sugar goes down, their cholesterol goes down, their blood pressure goes down, their energy level goes up. They just feel better, and that's irrespective of how much they weigh. They just feel better. And there is no pill that you can take that will do that for you.
I'm more active. I play with my dogs. We do gardening. My husband and I got a lot more energy, and overall I'm much happier. It's bite by bite and minute by minute, and you just, you don't have to make huge changes. You can just make a little change. Just substitute one candy bar or one sugary drink for a piece of fruit. We have so many selections of fruits and vegetables on the Central Coast. They're all over, and so really there's no excuse of not having the availability, and they're delicious. That is my candy now. I love my doctor. She's such a good example to me. She doesn't just tell you, she lives it herself.
She knows how proud I am of her. I used her story to inspire other patients because she did it. She did it. She didn't get a degree in nutrition, and she didn't start becoming an Olympic athlete. She just did it one step at a time. She took her time. She didn't expect to change overnight. She was consistent. And so that's something that I would love all my patients to do. And a lot of patients do. They try really hard, and they do get good results.